Welcome to Unpacked with Papa, where we unpack the belief that social health is health. I'm so excited to welcome today's guest, Dr. Jennifer Molinsky. She's the director of the Housing and Aging Society program. This is part of the Joint Center for Housing Studies at Harvard University, and she's also a lecturer at the Graduate School of Design at Harvard. Welcome, Dr. Molinsky.
Well, thank you. I'm so happy to be here.
So your research explores the housing challenges our aging population faces. And then late last year, you put out this really illuminating report called Housing America's Older Adults. And the report found a lot of different things, but one thing that really stood out to us was that many older adults cannot afford daily in-home care. So to kick us off, I'd love if you could just walk us through some of the key findings from the report.
Sure. The report, which is over my shoulder here, really covers a lot of demographic, financial, and housing trends, but we did a special section on the intersection of housing and care and supportive services. I think one of the big themes this year is that we are on the cusp of the baby boomers turning 80. And when people are in their 80s, we see more affordability challenges with housing. We see more need for accessible housing, and we see more need for supportive services and long-term care in the home. And so we already know we have challenges in all of these, and just looking ahead to a larger population in that situation, we know that there's a lot of work to be done. And so one thing that we did do is try to understand what we call the dual burden of housing and care. So if you think about housing costs and the care costs together, what does that look like? So we looked at 97 metros for which we had data, and we looked at single people 75 and over, and found that of that group, only 13% could afford assisted living, and only 14% could afford a daily visit from a caregiver, a paid caregiver, to their home each day. So really alarming, I think, in terms of the growing need.
Yeah, that gap is huge. You know, you've put out reports like this for many years now. Why this year was this really a shift from looking at just housing to housing and care together?
I think that people are just catching on to the idea that these needs are imminent, that, we have been saying for a decade that the time is now to act, to put things in place that will help older adults age in the home of their choosing. And most often that is in the community in which they are already living. And but I think we're just getting closer and closer to that point of we're really going to see a lot of needs change, and a lot of individuals are going to need to, think hard about what to do.
To that end, we've had these societal shifts that have changed what a community looks like today. And I think we can all unequivocally say that there's less physical community today than decades prior. The type of housing that we live in can clearly add or subtract from our social connection. So what is the solution to increasing community and connection, and how can housing play a role?
Well, I think from the housing perspective, there are several dimensions to improving people's connections to their communities. I think at a very basic level, accessibility in the home is actually a problem for people getting in and out of their homes to engage in the community. People are homebound because they can't actually navigate the steps, or they don't have transportation once they leave that front door. So I think there's a whole set of infrastructure priorities in the home and in the surrounding neighborhood that are really important. And these days, a lot of social connection is happening online, and of course, not everyone has broadband access. I think I'm a big believer in neighborhoods that offer multiple types of housing that serve people of all stages of life and household configurations. We have a growing number of single person households of all ages, but especially at the older ages. And we also have a growing range of multi-generational households. I mean, that whole configuration is changing. We need housing that serves all of those people. And I think when you can put people side by side, there's more chance for interaction and mutual support, for learning from each other. And older adults in multi-generational communities have expressed that they find a sense of purpose in that. And so I think it's really important in that way. I think, you can accomplish some of this if you have age-restricted housing in an all-ages neighborhood. But I think what I have seen is that when you have age-restricted housing sort of tucked away from a neighborhood, it's worrying to me because when we don't see other people, we can forget about them. And I think having people of all ages and abilities and, um, you know, households and all that, being able to engage in the public realm, engage in our neighborhoods, that's a really important thing for all of us.
I know this multi-generational housing is more common in other cultures. Have you seen creative ways to make it more accepting and the norm here for Americans?
There are some really creative, wonderful intergenerational communities. And by that, I really mean ways of bringing people of all ages to live in the same kind of community or property, even though they may not be living in the same household. Everything from co-living, which is very popular in Europe, and really, there's a whole history of it there and a history of government support even, to places that support people, families adopting from the foster care system and older adults who live on site together. So there's a real range of opportunities, which is exciting. I think the challenge is really how do we scale those up? A lot of the programs and the sort of subsidies that they rely on to support people with low incomes are, they're limited to older adults, or they're limited to this population or that population or this situation. And some of these creative solutions kind of break that down. And so, we need to, they cut across those silos. And so we need to do a better job, I think, of enacting policy that's supportive of some of these creative solutions.
My last question for you, there's been real significant momentum focusing on social drivers of health. It's been a lot easier for health plans and organizations to focus on things like food insecurity or transportation access. But housing, it's daunting. It's a much larger challenge. It's, bigger expenses. So what can we do to make the case for more focus on housing as a means to better health? And ultimately, what health plans care about are lower healthcare costs.
Mm-hmm. Well, I think more than any other age group, older adults spend most of their waking hours in their home. So, right, it is just so central to their physical safety, to their health and well-being, and to their financial security. And that financial security part, I think, is important in two different ways. One, and we know this from lots of research that came out of the Great Recession, when people can't pay for their housing, that creates a lot of physical and mental stress, and that affects health. And the other thing that we know is that people who are burdened by their housing costs will spend less on food, they'll spend less on out-of-pocket healthcare expenses. And so we did a paper about people foregoing prescription medicines, for instance. So there's a lot of reasons to think about the way that we can support people in their homes, with the physical home, the affordable home, and that being really important. I think the way that people's homes are connected to the community is important too. As we talked about, engagement with others is healthy, and loneliness and isolation are have severe effects. So, everything that we can do on that sense too. And then I guess, I think we just maybe need to recognize the reality is that a lot of people are really stuck for options. They're just Medicare is not going to cover, it doesn't cover housing, it doesn't cover long-term care in the home. Medicaid is not covering for those middle income people. So if only 13 or 14% can afford care in the home, that's a lot of people that are left out of the current system. And I think it's great that we're having conversations like this between the health side and the housing side. I think we have so much further to go, because right now, if you qualify for housing assistance, you don't necessarily qualify for home and community-based support under Medicaid, and vice versa. And the two systems are just operating completely differently. But you, as a user, you need to make those things work, or you as a caregiver. And so I think we could do a lot better in terms of making sense of the whole system.
It sounds like we all need to focus on marrying the home, care, and community in order to really progress towards
I think so. And the challenges, obviously, as I started out saying, are only growing, and we just we could do so much better. And I think there's an obligation and a duty, I think, to do so much better by our older adults too.